Good evening, professors, guests, and fellow schoolmates. I'm Candy Ma, the group leader for our project titled Promotion of Children's Oral Health Through Knowledge Building Among Antenatal Women. And then I have dear group mates, namely Alex, Stephanie, Joseph, and Super. We are all Year 5 dental students now. First, I would like to explain the reasons why we would select antenatal women as our target audience. According to the Oral Health Survey in 2001 conducted by the Hong Kong Department of Health, almost half of all 5-year-old children have tooth decay, and over 90 of their decayed teeth are untreated. Moreover, in a research paper published in 1993, it is found that both feeding and oral hygiene habits are the main reasons for the tooth decay for the young children. Another paper published in 2010 states that abnormal feeding routines and sucking habits would lead to malocclusion. Therefore, both mothers and caregivers certainly play an important role for preventing early childhood caries and malocclusion because they can be actively involved in their children's bad oral habits, breaking and helping them to develop a good oral habits. And finally, a paper published in 1992 reported a strong relationship between child's oral health and dental knowledge and attitude. And moreover, over 80% of 510 mothers in one local study reported not having received any oral health care information during their ante and postnatal periods, and most of them wanted more oral health care information. Therefore, we can see that there is really a huge knowledge gap between mothers or caregivers and oral health care professions in these important periods. And as a future dental professions, we believe that prevention is better than cure. And we definitely have the responsibility to promote public oral health. As a result, by designing this knowledge exchange activity, we aim to help mothers care for their offspring oral health. This is our project objective, is to promote childhood oral health by improving antenatal women's knowledge about feeding and oral hygiene habits of the young children. Regarding the recruitment of the participants, actually, we contacted two centers. It's the Sai Ying Pun Maternity and Child Health Center and Antenatal Hospital. But the Sai Ying Pun Maternity and Child Health Center is under the Department of Health. So as we are informed that the application procedures usually take a long time, and we probably cannot see the approval before the deadline of the KE application. So we select the Antenatal Hospital, and it's under the Queen Mary Hospital. And after contacting the Professor An from the Department of the Obstetrics and Gynecology, we obtained approval for holding the talks in this hospital, and then we designed a poster and did the online promotion on the forum Baby Kingdom, which is the largest online forum for the parents in Hong Kong. And for the details of the project, we plan to hold several workshops for 60 to 70 antenatal women. Each workshop included hands-on practice lasting for an hour, which aim to help the antenatal women build knowledge of the following skills, like the correct feeding habits for their infants, oral health maintenance for their young children, terminating poor oral health practice, and oral hygiene maintenance for themselves during the pregnancy period. The participant filled in a questionnaire as a baseline record for their oral health knowledge. Then a 20-minute oral health talk was given, and there was a Q&A section after the talk, and on-site oral hygiene instructions for adults and children were given individually, and hands-on practice was included. And finally, the participants need to fill the same questionnaire as before in order to evaluate the effectiveness of our oral health education. And also we designed a pamphlet and PowerPoint handout were given to them as their future reference. This is the pamphlets made by us. It covers the causes, signs and symptoms, treatments, complication, and prevention of pregnancy gingivitis. And it also covers the deciduous tooth eruption, causes and classification of malocclusion, and the tips for managing the baby teeth. Also, we would like to address the common misconceptions held by the pregnant woman about the dental checkup. And after conducting the interactive Q&A sections in the workshop mentioned before, we saw a need to provide in-depth educational consultation for this and other antenatal women. We further arranged with the coordinator in Antenatal Hospital to hold consultation booths in another 2 half-day sections. The antenatal women were able to consult us and receive professional opinions regarding their dental concerns. During the consultation period, questionnaires and pamphlets were distributed as well. Questionnaire we received, we can find that both the participants can understand the importance of their oral health care and is the relationship between the feeding and oral hygiene habits. And also they become more aware of the dental problems of the young children like the tooth decay and malocclusion. And they can learn the correct feeding methods. They can learn how to maintain the oral hygiene for their children and learn how to break the oral habits of the young children. And finally, we hope that they can know the importance of the early dental checkup during their pregnancy period and also for their kids. And here are the tips for the future students who want to apply for the KE project. Firstly, it's about the location. It is a really critical issue to determine how much impact your project can give. Actually, as our project as an example, our target number of the participants is 60 to 70. But about 20 antenatal women took part in the workshops, and some participants told us that the location was very inconvenient for them. So we recommend that the future project can be held in some large events, as the recruitment of the participants will be easier. And secondly, we found that Q&A booth was very welcome by the antenatal women, and the exchange of the knowledge was found very effective and efficient between our target audience and us by holding the Q&A section. And thirdly, we suggest that you can fully make use of the grant to do the mass copy of their prepared materials. Also, you should keep up all the bills and use up all the fundings before the deadline. Last but not least, we highly recommended that you can use our project as a blueprint for to further develop the dental knowledge transfer between our profession and the mother-to-be or the mothers. And finally, I would like to give our sincere thanks to the Professor Ann from the Queen Mary Hospital, Ms. Lee from the Antenatal Hospital, and then Dr. Yang, Dr. Traveling, Ms. Jack, and the Knowledge Exchange Unit. And finally, I would like to give my sincere thanks to all my group mates. Thank you.